Dr. Matthew Devine, the medical director at Highland Family Medicine, is back with us this morning. Doctor, good morning.
Good morning, Mark.
Our topic, the one that's on everybody's minds right now, and that is back to school. Let's talk about what this means, what's in place for students, teachers, and administrative staff as well when it relates to going back to school. How do we do it safely?
Great question, Mark. I think what we would say is most teachers and professionals at school districts really haven't had a summer vacation. They've been spending most of that time getting their classrooms and facilities ready for children to return in a safe manner. And essentially, there are some themes to what is going on in each and every school that they're slightly different as far as how many kids come and et cetera, but the social distancing, the masking, all of those other things that we've been talking about in our community are very similar.
Screening, of course, is important as well. Let's dive in on the CDC reopening guidelines because there's some key recommendations here.
Yep. So essentially, the CDC is looking at our community. If there are no COVID-19 cases in our community, then schools still have to do best hygiene of teaching of kids to kind of wash hands, monitor absenteeism if their children are absent for sick reasons, looking at sports events and things like that, and really kind of making sure that sick staff stay home. Obviously, if cases continue to creep up, then there becomes even more strict requirements that ultimately, if there is a surge, which we hope is not the case, then that could reflect in some momentarily or very brief periods of school closures, and depending on the scenarios.
Yeah, transmission obviously is so key here, and preventing it, of course. The X factor is children and perhaps teachers as well that might have an exemption for masking. Let's get into this because this is really important.
Yeah, so this is another complicated process. I think in general, there's been a task force in our county of pediatricians, family physicians, medical professionals, including the health director, commissioner, and essentially what's put in place is there is a medical exemption form that children would have to complete if they are not going to be required to wear a mask in schooling. And there are some fairly significant reasons, mainly kids with neuromuscular disorders, severe developmental or behavioral problems, or serious emotional disturbance.
Doctor, let's finish with this. Give us a sense of where the medical community stands when it comes to schools reopening.
So essentially, our stance is that children need education, children to continue to kind of meet and have some socially distanced interactions. They need to continue to learn. There are so many other things that school provides, not just academics. And so essentially we want and we feel that it's safe for children to kind of proceed, assuming that all of these other measures through the CDC, through the county, and all those other things are followed very particularly.
Doctor, we'll leave it there. Such an important topic. As always, we thank you for your expertise.